This skill scenario is a collaborative effort. You will be working as an EMS team of 2. Rescuer 1, first on scene, will do the assessment. Rescuer 2, second on scene, will be delegated tasks such as vitals and treatment by Rescuer 1. During the scenarios, rescuers shall wear appropriate PPE, gloves, and use all equipment to take vitals and perform procedures. The scenario will conclude with the patient report to higher medical authority. You may now check your equipment. You respond to the scene of an unconscious beach patron. Upon arrival, you find an adult male lying supine in the sand. You note hypodermic needles next to the patient.
I have my BSI on. Is my scene safe?
You are on the back of the beach in the sand. As you approach the patient, you notice a needle to the side of him.
How many patients do I have?
You have 1 patient.
The mechanism of the injury is unknown at the moment. I'm going to request additional resources.
Resources are en route.
At the moment, there's no need for spinal motion restriction. As I approach my patient, does he look up at me?
The patient's eyes are closed.
Hey, sir, can you hear me? Can you hear me? Does the patient respond to verbal stimulation?
The patient does not respond.
Hey, sir. Does the patient respond to painful stimuli via interdigital pressure?
No response.
Okay, my patient is now unresponsive. I'm going to check for a pulse and breathing for no more than 10 seconds. Does he have a pulse and breathing?
The patient has a pulse and is breathing.
When I inspect my patient's airway, what do I note?
The patient's neck is bent and you hear snoring. You also note vomit on his shirt.
I'm going to form a head tilt chin lift to open my patient's airway. Does this alleviate the snoring?
The snoring is alleviated.
I'm going to assess my patient's breathing rate and tidal volume. Is it adequate?
The patient takes a breath once every 10 seconds with shallow tidal volume.
So my patient's breathing is not adequate. So Rescuer 2, could you grab a BVM and bag my patient with O2, 1 breath every 5 seconds? While you do that, I'm going to grab an OPA, size it, and apply it. All right, I'm going to measure the OPA and then apply it.
The patient gags on the airway adjunct.
All right, my patient has a gag reflex. Keep on bagging him. I'm going to take some lung sounds really quick. What are my findings?
Clear bilaterally.
I'm also going to assess my patient's heart rate, quality, and skin signs. What are my findings?
The patient has a palpable radial pulse with a normal heart rate. Skin signs are cool and pale.
I'm also going to check my patient's pupils. What are my findings?
The patient has pinpoint pupils.
So we arrive on scene, an adult male, unresponsive. His airway is patent after we've performed a head tilt chin lift. We are bagging him at 12 breaths per minute. His heart rate is normal. Skin signs are cool and pale. Based on his pinpoint pupils, the drug paraphernalia, his hypoventilation, and his non-responsiveness, I am going to assume that he is having an overdose. We're going to hold off on the Narcan until more resources arrive. All right, I'm going to do a rapid head to toe.
You do not find anything on the rapid head to toe.
Okay, at this point, I'm going to take a set of vitals. You keep bagging him.
Set aside an alcohol wipe, lancet, test strip, 4x4, and Band-Aid. Cleanse the site of injection with the alcohol wipe. Depress lancet against patient's finger. Place place lancet in sharps container. Wipe away the first drop of blood with a 4x4. Insert test strip into glucometer. Allow drop of blood to make contact with the end of the test strip. Read glucometer.
And what are my findings?
You got a blood pressure of 112/80, heart rate 68, respiratory rate 12, bagged, SpO2 98%, skin signs were pale, blood glucose was 110. Law enforcement is now on scene.
Okay, now that additional resources are on scene, we could administer naloxone to our patient. This is the correct drug. The indications are met. The packaging is intact and the drug is not expired.
Your drug is diced and can be administered.
Open the box. All right. In a second, you're gonna take the BVM off and I'm gonna put it in and then put it right back, okay? All right, ready?
Yes.
And let's go. All right, go ahead and bag them again. I'm gonna go ahead and take another set of vitals. And what are my findings?
Blood pressure 116/80, heart rate 66, respiratory rate 12, SpO2 95%, and skin signs are normal. The patient begins to move and is making sounds. Paramedics arrive.
Hi guys, how can we help?
So we arrived on scene as adult male, unresponsive, lying supine. His skin was pale and cyanotic. Breathing was very shallow and slow. So we started to bag him at a rate of 12 breaths per minute. His heart rate was strong, kind of fast. We eventually administered Narcan, to which the patient came to after a couple of minutes.
Great, we'll take it from here.
Thank you.